Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland and today is June 12th, 2020. As always, we start out with our COVID-19 statistics. Throughout the world, we have more than 7.7 million cases now and over 427,000 deaths. In the United States, we currently have over 2.1 million cases and nearly 117,000 deaths. We do have some really good news today about COVID-19 though, so we'll start with that. New Zealand has announced that they have completely eliminated COVID-19 from their country. They haven't had any cases in 3 weeks now, and they don't currently have any active cases. The way they did this was by conducting widespread testing, using strict quarantine procedures for those that tested positive, and also restricting travel inside and outside the country. They've now lifted many of their internal restrictions, but they are still strictly enforcing restrictions for travel inside and outside the country in order to keep themselves safe and to keep the COVID-19 from coming back to their country. Moving on to other news about COVID-19, a small study shows that the drug that's found in Pepcid AC, the heartburn and acid reflux medicine, may help reduce the severity and duration of COVID-19 symptoms. The initial study was very small, and so it's not conclusive by any means, but they are going to start a clinical trial which should help verify those results or prove them wrong, either way. Hopefully it does prove them correct, because if that does happen, it'll be a major game changer, because Pepcid AC and its generic equivalents are easily accessible. They're everywhere. You can find them at Walmart or any other store. And they're fairly inexpensive, especially compared to many prescription-type drugs. A new observational study that was performed on Wuhan, China, claims that Wuhan, China actually was experiencing COVID-19 in late summer or possibly early fall of last year, 2019. The study, again, is not conclusive yet. It still needs to be peer-reviewed, etc. But it does show a number of things that are quite convincing. First, they looked at satellite imagery of the parking lots and the traffic patterns around Wuhan hospitals for that time period and compared it to the year before, 2018, for the same time period. There was a marked increase during 2019 of vehicles at and around the hospital. Usually in other studies that have been done that are similar, that means that there is some sort of infection going around the community. For example, in the United States, sometimes this has been done to determine if a flu outbreak is happening. And so that's one of the things that they found. They also found that during that same time period, late summer to early fall of 2019, the internet searches increased dramatically for specific symptoms that we now know are symptoms of COVID-19. So if China was experiencing the COVID-19 virus that early, late summer or early fall, it means that the United States and the rest of the world could have actually become infected also much earlier than we currently think. And so, it's possible that there could be more people that have been infected, and we just haven't gotten the proper testing done yet to determine, how many really are infected. This past week, the World Health Organization stated that some of their studies have shown that it's actually rare for asymptomatic people to pass along the virus. That goes against what a lot of other organizations such as Harvard Medical and the Centers for Disease Control have said, because they estimate that 30 to 50% of all infections or the spreading of COVID-19 is caused by those who are not showing any symptoms. Even Dr. Fauci, the face of the pandemic response here in the United States, he went on air afterwards, after the WHO's announcement, and stated that using the word rare is incorrect, because they've seen many studies that show that there are quite a few cases caused by spread by those who are not symptomatic. In general, right now, the general consensus from a majority of studies is that asymptomatic spread of COVID-19 is a significant part of COVID-19 cases currently. The WHO actually stepped back a little bit from their initial statement and said that there are still quite a few unknowns. Apparently only some of their studies had shown that it was rare, others were more in line with the studies done elsewhere. So as of right now, the recommendation is still, even if you're not showing any symptoms, you should still wear a mask and practice social distancing. A number of new studies have come out this week about antibody testing. Now, antibody testing is different than the nasal swab that most of us know about. The antibody testing actually grabs a sample of your blood and then they test it to see if there are any antibodies specific to COVID-19. If there are specific COVID-19 antibodies in your blood, then that means that you are either sick with COVID-19 currently or you were sick in the past. Because your body creates those antibodies in response to COVID-19. Some of those studies, what they've shown is that the quality of the tests is quite variable. There are basically three basic types of tests that are done as far as the quality of them. The first type, the one that's the most accurate, is the one that's done in a medical setting, such as a doctor's office or a hospital. And the lab work is done by hand. That one typically has anywhere from 95 to 100% accuracy. The second most accurate is the type that's still done in a medical setting, but some of the lab work is automated. That typically has anywhere from 90 to 96 or 97% accuracy, so it's still quite accurate. The least accurate of the three types is the commercial type. The commercial type means either at-home testing, where they send you a kit and you do it yourself, or the drive-through type of testing. Those commercial types of testing are only about 80% effective. So still better than nothing, still worth using to get a better picture, but just not as accurate as the other ones. The commercial ones are typically a bit cheaper and easier to do than the ones done in medical settings, and so that also makes it important to use those so that we can get those tests out to more and more people, because the more tests we have, the more accurate our numbers are as far as cases and deaths, etc. Another bit of news, 23andMe, the DNA ancestry company, they found evidence that blood type can actually affect whether you get infected or not. What they've found is that those with blood type O, either O positive or O negative, it doesn't matter either way, but if you have blood type O, you are 9 to 18% less likely to get COVID-19. Now, that's not a huge difference, but it is statistically significant. Also, they say that those who do get it, those that have blood type O, but they do get COVID-19, they typically have less severe symptoms. It's important to stress here, though, that having O positive or O negative blood does not make you immune from getting COVID-19. It increases your chances a little bit to not get it, but it does not make you immune. Also, there's no evidence that you would be less likely to pass it on if you did get it or anything like that. So at this point, the recommendations still stand. Everything that we've said before: use face masks when you go out, wash your hands, practice social distancing. All of that needs to still be done. Now on to some public health news that isn't related to COVID-19. First, everyone should exercise. Okay, not mind-blowing, everyone's heard that, everyone knows that exercise is good for you. This week, though, we got a little bit of news that helps to bolster that claim. A study found that those who are suffering stiffening of the arteries, called atherosclerosis, are much less likely to die if they exercise. In fact, they looked at those who had the most atherosclerosis, the highest level of it, and if they exercised, they actually had an equal or even lower chance of dying than those who had almost no atherosclerosis, but they didn't exercise. So everyone should exercise. It can save your life and make the life you live now healthier and make you feel better. The last bit of news we have this week, researchers at the University of Utah have found a way to make life easier for people with type 1 diabetes. By mixing cone snail venom, it's a type of sea snail, by mixing that venom with human insulin, they were able to make a fast-acting insulin. Typically, the human insulin that most people use now it takes about 20 to 30 minutes to become effective, and so before a type 1 diabetic eats a meal, 20 to 30 minutes before they have to take insulin. This type of insulin would work in just 5 minutes. Because of how quickly it works, it could also be used in emergency situations. I'm Richard Greenland, and this has been the Plain English Public Health Weekly Report for June 12, 2020. You have a nice week.